So a little bit about LTCCC. For those of you who don't know us, we are a nonprofit, nonpartisan organization entirely dedicated to improving care and quality of life for residents in nursing homes and assisted living. And the focus of our work is policy research and analysis. We do a lot of work, as I think many of you know, with nursing home data, and we publish the work and results of those analyses on our website, as well as on occasion in journals, et cetera. We use our findings to do systemic advocacy to work to improve care, again, for residents in nursing homes and assisted living. And more over the past dozen years or so, we have also focused on public education, such as these monthly programs, our newsletters, et cetera. And we are the proud home to 2 local long-term care homes and programs. All of the materials that we put out are available on our website for free, nursingHome411.org. And without further ado, I'm going to pass this on to our presenters today. I am really truly thrilled to have today's speakers. As I mentioned to a colleague recently, this was one of the best programs I've ever attended in my 20+ year career on nursing homes. So I'm really excited to have them today. And excuse me, programs, I first saw them at the conference of the National Consumer Voice for Quality Long-Term Care at their last annual meeting in 2023. So we invited Laura and Rachel to speak with us today. Laura is with Keck School of Medicine, but Laura has a substantial history in elder justice, that she's just one of the really one of the icons, I would say, in the work that we do to improve nursing home care. And Rachel Tate is with Wise and Healthy Aging. I hope I'm getting that right. And the two of them are going to discuss the Pasadena Elder and Dependent Adult Liaisons. It's a multidisciplinary team dedicated to improving care and quality of life for older adults who live in residential care facilities. And is that for later on? Sorry about that. I should know better. I'm going to stop sharing and hand it over to Laura and Rachel. Thank you.
Good morning, I'm Rachel. Like Richard said, I'm with Wise and Healthy Aging, the long-term care ombudsman program provider here in Los Angeles City and County, and our agency also is the ombudsman service provider for San Bernardino County. So we're going to share a little bit about one of the projects we are working on. We'll get through some of our logistics first. And thank you to OVC for their funding. A little bit about who we are. Dr. Mosqueda's resume is obviously far more impressive, but I think one of the things she often leads with is she is an ombudsman. And so we are both ombudsmen and intimately familiar with the needs and services of the folks in long-term care facilities. So that's really what drove this project. So I'll give you a little bit of an overview about sort of how we got here, how PEDAL became a potential answer for us, and some case studies and the outcomes that we're seeing. And as always, we're constantly moving forward in what we can do to make improvements and keep things going related to what is changing in the long-term care world. As many of you know, the problems related to skilled nursing facilities and compromised care and resident concerns is not something that is specific to just our area. This is a national concern with poor quality of care, abuse, oversight in several areas. And COVID-19 really exacerbated that problem throughout the industry. Here in Los Angeles County, we are a little uniquely positioned. Our nursing home enforcement is contracted out to our county. We're the only county in the country that has that sort of setup. And there was an investigation during that time about some of the needs and the failures of the system here in our county during COVID. The city of Pasadena is a little bit unique, and Also during that time, they had to evacuate 2 nursing homes, one in June of 2020, COVID, definitely distinctly COVID related, and one in October of 2020 related to environmental concerns within the facility structure and the safety for the individuals in that facility. And when I look back at that time, which I'm sure for those of you that are providing services to this community, feels like a million years ago and feels like yesterday all at the same time. When we look back at that, we realize that there were a lot of things that could have gone better. There was some failures of communication between different agencies and who was responsible for what, and a lack of knowledge for some of our city agencies and first responders about who is responsible for what in a long-term care setting and what the structure of a long-term care facility looks like and where do these folks go. And it became, not that it wasn't clear before, but it became very, very clear at that time that there was so much more that we could do to keep people sort of from working in those proverbial silos and working together, not only to improve the care for the residents, but also to improve the working relationships and the utilization of resources. So PEDAL is a grassroots solution. It's the Pasadena Elderly and Dependent Adult Liaisons team. And our mission is to ensure that the long-term care residents of this community are seen as the valued members of the Pasadena community that they are. PEDAL seeks to improve quality of life for elders and dependent adults residing in long-term care facilities through education, community outreach, code enforcement, and ultimately prosecution if all of the other things don't work right. So it's a unique blend of folks. We have representation from the city manager's office. Pasadena is one of the cities that has its own public health department. So we have representation from the Pasadena Public Health Department, the Pasadena Fire Department, the Police Department, the city's prosecutor's office, Planning and Community Development, the Long-Term Care Ombudsman Office, Huntington Hospital, which is the base hospital for our fire department within the city and typically receives patients from the local skilled nursing facilities when necessary. And then the Keck School of Medicine at the University of Southern California. So a unique blend.
And I just want to bop in and mention, if you can go back one slide, Rachel, to the mission statement. I think one of the really important things was getting people from city manager's office and public health and fire, et cetera, to recognize that the people who live in the nursing homes in our city are members of our city. And just having that explicitly stated and understood and was a very, very important step. And this was really Rachel's idea to make that clear to everybody and to have everybody buy in.
And I think, you know, I know that many of you are probably ombudsman. One of the things that sort of makes this team separate is there are things within the ombudsman world that we can't do, right? When it comes down to evacuating a facility, I can assist you in advocating for those residents and making sure that their voice is heard in that process. But ultimately, the fire department took the lead on that. Then those ambulances you saw lined up in that previous slide was from one of our actual evacuations, and it was a pretty intense night for everybody involved. So I think this allows people to really work to their expertise and work together so that the residents are benefiting from the expertise of all of the different participants. So our activities include weekly meetings. So we're staying on top of current needs, current trends, what's happening, who's misbehaving, who's behaving really well, who needs a little extra support, who maybe needs some PPE, who needs what. We do a lot of cross-department and information sharing where that maybe wasn't working so well before because you're tending not to share with agencies that you don't even know kind of what their role is. So we're able to identify facilities with high calls to service for fire or police because that's oftentimes an indicator of a facility that's trending towards having concerns that we need to look into. We do a lot of collaborative troubleshooting, and one of the great things about this team is because it's been relatively new and the only one of its kind so far, you don't get stuck in a lot of, well, we've always done it that way, we can't do it, because we don't really know what we can't do. So we're going to try to do it all, because that's just who we are. We're going to keep it going. We do targeted site visits. So different agencies that are represented on the team will conduct visits to facilities. And if it doesn't pertain to one particular agency or their services, then they don't need to necessarily come unless they're there to support others. And we'll talk a little bit about that in some of our case examples coming up. We also do consumer resources and training and a lot of outreach. So we have a website, and the website is broken into different sections. So sections for families and residents in long-term care or seeking long-term care, so they have a better sense of what it is they're looking at. Most people who end up in long-term care, have a conundrum that lands them in a hospital. They get handed a packet of papers from a discharge planner and they're told to pick one. That's not necessarily the easiest way to pick a facility. But we also do outreach to facility staff and to providers and things that are expected, and maybe a trend or a learning moment that we saw and how we can fix that. And then we hold an annual training event for the providers in the area. So why Petal? Why Pasadena? We're better known for things like the Rose Parade and the Rose Bowl. So why here? COVID highlighted for us here in LA County, and I'm sure for many of you elsewhere in the country, the number of facilities you maybe have in certain areas. When you realize your resources got taxed when everyone was in an outbreak state, and what are we going to do? We realized that in the city of Pasadena, we have a pretty high concentration of skilled nursing facilities and assisted living facilities per capita based on the population of surrounding cities. We have more than others. The city also is uniquely positioned in that it has its own public health department. And so the resources, the staff, and the culture of the city are pretty unique in that they do incorporate all members of their community, and they work very hard at being inclusive. And then I would say a unique long-term care ombudsman program, only in the sense that prior to the current position that I'm in, I was based in the city of Pasadena probably longer than any LA County ombudsman has ever been. I'm also a resident of the city, so I know the city pretty well inside and out. And I know these facilities pretty well as well. So what does it take to get something like this started? I have to say it takes, for those of you that are ombudsman, it takes that persistence. It takes having people say no to you repeatedly and saying, I hear your no and I do not accept it, respectfully. So it is the right group of people at the right time, and it's patience and persistence and a commitment to really ensuring that the residents of your community are provided the opportunity to have a voice and a seat at the table.
And we might, if there's time, talk a little bit about this later, but I think this is sort of typical of a lot of multidisciplinary teams for a variety of issues related to elder abuse. I think of it as sort of setting the table. You have the table set and ready, and you might not have the right people come to the table, but as soon as you do, you're ready. You've got the meal fixed and ready to roll.
Mm-hmm. And I will say Petal did not, oftentimes people think that it took off after the first evacuation, and it really didn't. It actually took 2 evacuations before the people at the table said, okay, now we got to do something. So I think that's an important factor just for people to realize. Our ombudsman program here is a little unique just based on our sheer volume and size. We have more than 1,800 long-term care facilities here in the city and county of Los Angeles, plus an additional 300 in San Bernardino County. So all told, our agency has the ability to provide services to more than 92,000 residents at any one time. And we are uniquely positioned in the way that our counties are laid out. Little known facts about us here in Los Angeles County: we have a skilled nursing facility in Catalina Island. And we also have facilities out in Big Bear. We have facilities that are very diverse, both in population, location, and geography. And Petal works uniquely in Pasadena, but our approach is different in different communities because we have to respond to the community that we are serving. So a little bit about Petal. Petal is the researcher who was on our previous slide, Julia Martinez, I believe, came up with this, and that it's a little bit of a carrot and a stick approach. We do as much as we can with the carrot, which is building those strong relationships, providing collaboration and teaching and technical assistance. The team itself got together and did motivational interviewing training, which was a great team building experience for those members of the Petal team that were able to do it together. And it helps sort of break down the walls of communication between the agencies. But then we do not stop at that. There is also a coordinated enforcement effort with consequences for facilities that choose not to do what they need to do right by and for residents. So I think it's really important to realize that the idea was not to come together and just be punitive. The idea was to do as much as we could to support residents, but to also not be afraid of saying, if you're not going to do right, we're not going to tolerate that in this city. So some of the outputs and the outcomes that we have done with Petal is we have created a system of what we call CRIBs, or critical information bulletins. We do not identify the provider or obviously the residents involved, but when a situation happens in the city, it can be condensed into a critical information bulletin, which is a training tool, which is then sent out to all of our skilled nursing providers. For example, if you have a patient with a DNR and you choose to resuscitate them, this is some of the consequences. So this is what their rights are. This is what you should be doing. This is the standard of care and information like that. So we use them in response to particular incidences, but we also use them to promote quality care. And so we've used it to promote things like resident councils, family councils. What are the rights of residents and families in those situations, and why should facilities be encouraged to participate and to encourage the development of councils? We've also done a symposium for the facility operators and medical directors where CEUs were offered, and they were provided education based on current trends and topics in the area of things we were seeing and how we could get the most impact by doing as much outreach as we could to the whole group at the same time. Again, the city is uniquely positioned in that it has a community center on the same street where a large amount of the nursing home providers are. You can literally walk down the street and come to the training. We do a lot of community education and PSAs on financial exploitation, including bus bench displays in both electronic and print format, and they've been widely successful in massive outreach. I think last year we had them in the winter, so when the masses descended upon our city for the Rose Parade, they all got to see our message out there on the parade route as well, because they were in all of those bus benches. We also are working very hard at ensuring communication with the county survey agency. So again, our county has a little bit different than for some of you in that it's contracted out to our county. And so having meetings expressing concerns both in writing and related to specific concerns. These incidents have happened in our city. We want to know what the enforcement action is, or this regulation about emergency preparedness has come out. How will it be carried out in our city? How can we ensure proper disaster preparation and that type of thing? It has created a sense of a no wrong door for long-term care facility issues. At this point, if you were to take a long-term care facility issue to the city manager's office, they actually have an understanding of long-term care facilities now. If you take a concern to the police department actually has an understanding of long-term care facilities now. So really, any department you go to within the city will eventually get it to the right area if it's not them, because everyone is working together and communicating more openly. We have a couple of case studies for you. So one was one of our assisted living facilities, and it was noted by Petal team members, specifically the fire department, that they had an extremely high amount of calls to service, higher than their counterparts in the city. And it became a bit of a concern. And it was discussed at Petal about what could be causing it and what we could be doing about it. There was one particular incident at this facility where a resident was left unattended in a vehicle, and that really brought everybody's attention to it, obviously, because there was this neglect matter. And then kind of peeling back those layers of the onion and discovering that there was a high volume of service calls, and what could that be? And in really line iteming and going through some of those calls, we discovered that many of the calls were actually residents calling themselves saying, I'm not getting services and I need someone to come help me. So we wouldn't want residents in a long-term care facility feeling the need to call 911 to get medication administration. That's a problem. So we were able to identify that there was some miscommunication, some systems failures, and some things like that. So what we were able to do here is, again, break off into targeted visits with the relevant team members. So in this case, the long-term care ombudsman program did joint visits with the fire department. First, to sort of ascertain needs within the facility, and then a very specific targeted outreach of doing training for facility staff. And when 911 is activated, what is required from you? How do you transfer the care properly, safely, and with the resident at the forefront of all of our efforts? We also did outreach to the resident council meetings and family council meetings to make sure everybody was on the same page about what can you reasonably expect at this level of care, what services are supposed to be provided to you, and what you can and should do in the event of an emergency. It opened a great opportunity of conversation. We had residents that were able to talk to the fire department personnel about, even if there were a fire in my building, how would I get out of my room and what would be expected of me, and things that people had never really taken the time to talk to them about. And it was clearly, for at least one resident, clearly on the forefront of her mind about what she should do, and she was able to sort of walk through that process. We have seen great success, and for the last several months, calls to service at this location have actually been reduced, and we are seeing residents reporting positive outcomes on our visits. So we had another situation in one of our skilled nursing facilities, and again, we've created this no wrong door approach in the city. So city personnel has received training and outreach about responding and reporting concerns in long-term care facilities. And the water department noticed a significantly high outstanding bill at one of our skilled nursing facilities, to the point that would, for many businesses, result in a shutoff. Because it was a skilled nursing facility, they immediately brought it to the city manager's office. And the city manager, the assistant city manager, who's a part of the Petal team, was able to bring it to the team and ultimately escalate it to the regulatory agency, because there's obviously a concern about funds to operate if you're not paying your water bill, and what kind of services would be provided. But first and foremost, what the city was able to step in and say is the water will not be shut off in this location until all these other things are hammered out, because we have residents that we value in this facility and we will not leave them stranded like that. And that really goes back to that key understanding of personnel within the city knows when they see a facility or when they respond to a facility, what it is they are responding to. I will turn it over to Dr.
Yeah, so I think, one of the powers of our working together is that, I come from a university background. I'm a volunteer ombudsman for about 10 years. So that allows me to go in and typically now I think I'm used in more as a volunteer in some unusual situations, which we could talk more about later if we want to. But we are also able then to bring some science to all of this as well, and to study it. And we use something called a logic model that we don't need to go through. The main point of this slide is to say that when we got a grant to try and kickstart some of the work that we're doing, we really wanted to do it in a logical, methodical sort of way, and to think about not just to measure what we're doing, but really to help the whole team think about what are we trying to achieve? What are the benefits we're trying to achieve from a whole variety of standpoints? And that's when we talk about on the far right side, the outcomes and the impacts. And if we go to the next slide, we'll talk a little bit about a study, a type of work called ripple effect mapping. And ripple effect mapping is simply a method from statistics that allows you to study these really complex systems. And just to show you how simple-minded I am, those of you who know me already know this, I'm like, there's so many ripple effects from this. There's got to be a way to study it. And then you look it up and you go, hey, there's something called ripple effect mapping. It's a well-validated scientific method. And so indeed, that's what we're using to study what it is that we're doing. So you don't have to do it ahead of time. You can do it as you're going to study what are all the different impacts that you may be having. And as you all know, rarely is this a linear type of thing where you did A and B occurred, but usually you do A and a whole bunch of different things occur, and some of them occur the next day and some of them take a year. So we really wanted to see the impact of one small change. And on the next slide, we talk a little bit about some of the outreach and awareness. Because just the fact of that we were able to get these other agencies, and when I say we, it's 98% Rachel, getting these other agencies involved and responsive. And sometimes it helps when you get other people on the team who have initials like MD after their names. It can sometimes help bring others in as well, and get the paramedics' attention a little bit more, or get the city's buy-in a little bit more. And if we go to the next slide, we'll talk about the really importance of the long-term care ombudsman, because this group through Rachel was the driving force behind setting this up. And then all of us really bought in. There was a question earlier about how did you get people to recognize the value of the residents? And I think a lot of it just has to do with us as role models. When we're on these teams, we bring these people in, and I think they hear about the passion and the care that we have in terms of resident rights and advocacy. And I think, frankly, it sort of inspires the others to recognize that the people who live in these facilities are indeed members of our community. And if there's a problem, it has a really big impact on our community as well. So bringing the city department together has been important. It's been amazing. I think, I'm thinking, Rachel, recently we're talking about a facility where we have a lot of concerns that might even raise to, criminal or matters, and, and that we're able to talk to the police about perhaps going in and interviewing some folks. And we know that that's likely to get people's attention. And then Rachel and I are able to help kind of prep the police for what that interview might look like. What questions might we want to get answers to?
The other thing is providers have been able to ask us for assistance. So just because a provider is maybe struggling doesn't mean that they don't want to do the right thing, right?
Yep.
So we've had providers that call us and say, we don't know what is expected at the transition of care. We don't know how to do this properly. And we're able to coordinate with the EMS chief and the ombudsman program and provide facility in services. So if you come forward saying you need help, the Petal team is going to step in and help. And we're happy to do so.
100%. And I think this was demonstrated at the conference we did last year, where we invited all these facilities, and we knew that they were sort of coming because they felt like they had to, et cetera. But by the end of that, it was about a day-long symposium, not quite. Everybody was so excited and enthused. They were already talking about helping us plan for the next year and what they wanted to do, because we really gave a safe space to have an open dialogue where it wasn't, this sort of accusatory type of thing, but that they were also able to say things to the paramedics like, hey, sometimes, you come in and you kind of act like jerks here, and we don't like that. And they had the chief there saying, tell me more. I want to know what that is, because that's not acceptable. So there very much was a feeling of it going both ways. And I think that really has helped the cohesion as well among the departments, because these meetings that are every Thursday morning, the team is helping each member of these different agencies to do a better job and to do it more efficiently. So if we go to the next slide, we can see that that we are trying to use things like data to see what might be the problem here. Why are there so many 911 calls? We can see that some operators are actually making changes, and it looks like a number of nursing homes are sort of much more aware of us, much more aware that the city cares about the people who live in the facilities in our city, and are really taking a look at what's going on. And we definitely have seen behavior changes. And if there's time, we can go into that more later. If we go to the next slide, we can look at some of the cross-departmental knowledge that occurred. You know, we've had the meetings. We're looking for systemic problems. We're looking for educational training methods to help, and then implementing things like information bulletins and the public service announcements we talked about. And it's hard to prove, but it does seem like we do feel like we're seeing some changes in behavior and some improvements. The next slide is kind of crazy looking, and I apologize, but my only point here is that ripple effect. And so this is a little bit of a graphic kind of cartoon representation of you have those pedal team meetings in the middle, and it starts to ripple out in terms of what we see happening in the science behind ripple effect mapping. This has involved interviewing a lot of different people, hearing what themes emerge, and then putting those together. We can go to the next slide. There are still, you know, clearly a lot of persistent challenges. In terms of the team itself, we were really fortunate to get some funding from the federal government, which is ending. But I think because we all care so much about it and see the change it's making, all of us are committed to keep going. And it's not like the funding was a lot or was paying for people's salaries, but it did help, you know, sometimes pay for coffee and donuts at a symposium, or some of those PSA, the public service announcements, et cetera. It's been interesting to sort of break through some of the cultures. And as I think that everybody on this call knows, once you get to know each other, you know, that the public health department can just call me directly and talk about something, not even directly related to PEDAL, but related to older adults in our community. That's great. That is such a good feeling that we're getting to know each other and helping each other quite a bit. And then, Rachel, I don't know if you want to talk a little bit about internal and maybe some of the external stuff that we see going on, because I think we're all frustrated with the financial motivations of facilities and how that doesn't necessarily align with the best care, and trying to figure that out. But also kind of the political impact that we're having at the local level.
Yeah, I think it's been a really sort of unique opportunity to bring different sets of eyes and different opinions and a different lens to some of the different concerns that we have with nursing home transparency and who owns what and where is the funding going and why are people getting moved around the way that they're getting moved around. And we have the Board of Supervisors, the local Board of Supervisor for here, had a hearing recently, and people were able to bring forward their concerns. And that was a direct response to the PEDAL team saying, what is happening here? What is happening here? Why is it not a transparent system? Why are we not looking into these things? Why, you know, this OIG investigation was conducted during the COVID time, and why was this not, you know, further pursued? And so I think it's resulted in some changes. And our Board of Supervisors recently acknowledged Residents' Rights Month. And here in Los Angeles County, where we have nearly 1/3 of California's nursing homes, that's a big deal, you know. And the city of Pasadena has done it for years, and it's starting to sort of trickle down to other communities and other people. We often get calls now from other cities saying, we want what Pasadena has. And so we get requests to do some of that. And we're leaning more towards this opportunity to work with other cities because you have some of the same operators throughout our county, throughout the state, and in some cases throughout the country, where there's a system of bad acts in place. This isn't just a one-off in one city. There's room for all of us to be working together. And I think that's really important to keep in mind.
Yeah, and I mean, several years ago, there was an Office of Inspector General pretty scathing report about the oversight in LA County, and we discovered that a lot of that hasn't really been examined very carefully. You know, COVID hit, and then I think a lot of it sort of disappeared, and so we've been actively engaged in calling attention to that again and asking about resolution. And the city, interestingly, is looking at issues that are enacted at the state level that are sometimes either delayed or not enforced. And, you know, for the first time, we hear the city at these pedal meetings bringing up, well, maybe we can pass something here within the city. And that was just fantastic to hear people who run the city wondering out loud if maybe we can pass an ordinance that would provide better protection for our residents.
And I think if nothing else, it's helped start a dialogue of the system we have in place is not working. It's not working to what we as advocates want to see for folks, what we as family members want to see for folks. And so looking for those creative approaches, again, Petal doesn't know what we can't do yet, so we think we can do it all, and we'll keep trying. But it is great to hear the city saying, what can we pass something? Can we do something? What exploration can we do to make this difference in our city? I know there was a question also about sort of the rural thing, and I did want to point out that our meetings are currently done remotely. So we do them through Teams to keep people connected in real time. So we can take those meetings from almost anywhere. I know Dr. Mosqueda has taken them sometimes from hotels in other states, and we've managed to all stay connected. So I think now with technology, there are opportunities to keep people connected, but I think it also you have to be willing to pivot and change to the needs of your community. What works in the city of Pasadena may not work in the city of Glendale, may not work in the city of Santa Monica. Doesn't mean nothing would work. It means you have to change to that landscape. So looking forward, we are still working on accountability of regulatory agencies. You know, the city recognizes that the enforcement actions come from the regulatory agencies. And one of the things they are doing is saying to the regulatory agency, we have referred this case, or we know this case occurred in our city. What is the outcome? And challenging those outcomes. That wasn't a thorough investigation. That wasn't what we expected. Our staff maybe was not interviewed as a witness when they should have been. So looking at some of that accountability, empowering residents and families and doing outreach. You know, we have fire captains that carry ombudsman cards in their pockets and know that maybe an issue that they're seeing while they're there isn't theirs, but they know how to get that resident connected to an ombudsman and get them realizing that there are other avenues, you know, or sending an email to the ombudsman program saying, I think somebody needs to go check on this person. It's not a 911 medical emergency, but they definitely need a voice, right? So connecting folks, and I think that's a huge, huge piece of it for us. Training operators and staff, and I have to say, I personally love it when an operator calls and says, I need help and I need training. And there have been times where I've said, you know what, that's not me, but I can take it to the pedal team and somebody in that team is going to know who it is. It may not be me, but we're going to find you the right person for your need. And that's a really awesome thing. We're looking at replicating with modifications, replicating with changes that are appropriate based on the needs of the other communities where we're duplicating systems and services. And it really starts with outreaching to the agencies within the city, and the city's got to be willing. And the city of Pasadena stepped up and said, we're willing, we want to do better. So it's finding cities that are willing to do that. And then culture change and really reminding people. So one of our big pushes this year has been the right to vote. You have the right to vote, even if you're in a long-term care facility, and making sure that the city is taking that into account. The city of Pasadena has also made a very concerted effort. I think this was also in the chat about ensuring that older adults, whether community dwelling or facility dwelling, are included in their age-friendly plans for the city, and what does being an age-friendly city look like, and how can we contribute to that? So I think that sort of system and culture change within the community is critical, is absolutely crucial. We went quickly because we do like time for questions and discussion. So we did try to go as quickly as we can, and we can maybe.
Yeah, and Rachel, if it's okay with you, I might just sort of look at some of the questions in here and respond.
Absolutely.
So for those who are interested, the slides are all available to you, or will be made available to you, I know. And you might want to take a look at that slide that says program action logic model, because that's the kind of thing that you can use and adapt to your local jurisdiction, and see, because it's more sort of not theoretical, but it has a higher level. It's not specific to Pasadena. It's more of a thought process that can be useful to some. We have had a researcher on the team, and we showed you her picture, I think, at the beginning, Julia Martinez, and I do a bit of research myself. So we are also looking at bringing data together and publishing on this, which is part of the reason we did that ripple effect mapping. The other thing I just want to be kind of brutally honest about, so Rachel, you can beat me down later on this one, but it ain't the same everywhere. There are some places where APS is phenomenal, long-term care ombudsman is so-so. There's other counties or cities where it's versa versa. Long-term care ombudsman is fantastic, and this other group is so-so. There's somewhere that everybody's great and others where it's not. So you really have to see what's going on in your own place. We happen to have, I think, just a phenomenal long-term care ombudsman program in our county. And that enables us to do a lot more than other places may be able to. But I think, again, if you think it's important, you keep pushing, and we show up. We just show up, and it can take years. I mean, I just think we have to be honest about it. Can take years for the right people to get in place at the right time. And then when it does, you really want to jump on it.
And I think one of the questions was, how long did it take to implement Petal from initial concept? And I think it was sort of an evolution. So I can't say necessarily that I started with this mission of this is Petal and this is how we're going to get there. It started with slowly the building blocks of education and outreach. And education and outreach initially started obviously with facilities and residents, but within the city with the fire department, because the fire department here is the one who transports for EMS care. And sometimes they are the ones that bring forward things that say, I don't like how this patient's being treated. I don't think this is appropriate, or their end of life wishes are not being honored, and I'm being asked to violate their end of life wishes, and I'm not comfortable with that. And so that's really what started some of those dialogues, was some of these fire captains who came forward and found us and said, what is this? This doesn't seem to be working right. So we started some of those conversations and those discussions. I will say that in one of the evacuations, when you are in the street with all of these agencies until 3 a.m, making sure some absolutely terrified residents are safe and comfortable, and that's going to change your perspective on the world as we know it and long-term care as we know it. And you're going to become pretty fiercely connected when you go through something like that together. So that was public health, that was the fire department, that was us, that was the city manager, that was all of us out there in that street. And starting some of those conversations, and so nice to meet you, and thank you so much for your help, and thank you for what you're doing, that kind of thing. So that when it came around to the second evacuation, there was a little more familiarity. We know who to call, we know which one in this department can get it done, we know how to move those mountains, which is what it was. So I think that's really critical. And I had been saying for some time, I think we as a group could be doing something. And after the second evacuation, I said, the assistant city manager was there. And I said, you know, that idea I keep throwing out there, I really think, and he said, please call my office in the morning. This will be done. Because it got to that point where it was necessary. Again, it really comes down to the right people in the right moment and a willingness of spirit. It really does.
And I think the other thing that's happened is just sort of helping them connect the dots. So understanding, for example, that in the state, there's something saying everybody has to have a backup generator, but it's gotten delayed in terms of when it has to be implemented, which just seems insane, right? Because we keep saying, are you also going to delay the earthquake that's going to happen too, so that we don't need them? You know, it just, the fact that legally it's delayed doesn't make it okay for the residents. It's just been interesting now to connect the dots of the city and say, guess who's going to be responsible when that earthquake hits and there aren't backup generators? It's going to have a direct economic impact on the city as well. And so it's sort of that combination of not just what's right to do, but also all the other implications for the city and the costs for the city and et cetera. If these things don't come together, pointing that out, I think, has been useful and has been a little bit of an awakening for everybody from the city manager to fire department, first responders.
There's a question I can't resist in the chat. If the ombudsman is a high impact in the ripple effect, would doubling the number of ombudsmen have an impact on outcomes? A resounding yes. A resounding yes. And I say that as a representative for Los Angeles County, where we have an absolutely massive amount of long-term care facilities within our county, but also in smaller rural communities throughout this country. If it takes an ombudsman 3 hours to get to one facility, you're not going to get the same services as somebody who could get around the corner in 5 minutes and be in that patient's room and helping them in that resident's situation, or attending resident councils. You can't get to every resident council if you can't get there, right? Or in our situation, when there's so many that we can't get to all of them all of the time. So I do think the ombudsman program, and obviously I have my bias, but I do think the ombudsman program is a cost-efficient way to improve care, which ultimately reduces the amounts these other agencies and cities and other folks are being impacted on in their finances.
I want to make sure we get to the questions in the Q&A, if that's okay. I know, Laura, you marked a couple, and I think that you've gotten to both of them. So I'll just follow after that. There's an anonymous attendee who asked, how do you teach service providers, institutions that LTC residents are full members of a community?
Yeah, I think we did touch on that. You say it out loud, and you invite them into some of these to see what it's like, because a lot of people, especially at the levels that we're dealing with, have never been in a nursing home. And you know, you need to help them humanize that these aren't just numbers. Rachel?
I think it also comes down to modeling it. And when, you know, ombudsmen know this, when you get calls and they say, this resident is non-compliant and is so problematic, you know, what is it that they don't want to do that you're trying to force them to do? Because typically that's what non-compliance is about, right? And when you're in a facility, I hear you saying you have this great event coming. What do your residents think about it? What do the residents, you know, what was their plan? What was their input? How are they enjoying this? But is constantly taking it back to that person-centered approach, that resident-centered approach, and in the community as well. So that's been a real barrier sometimes for the police department. It's a very different perspective. And they say, well, the facility staff said this, that's great. What do the residents say? I'll go back out there and be back, ma'am. Thank you. Right? What was their perspective? And one of the things that I do a lot of training for law enforcement, and one of the trainings I do for law enforcement is I liken it to domestic violence situations. in a domestic violence situation, do you ask the abuser, did you abuse your spouse? And then do you take their word for it? You don't. You don't. So why would we ask long-term care facility staff, did this happen to your resident? Ask the resident first. Ask them for their perspective, and sort of shifting that focus that you've entered a long-term care facility. You haven't surrendered any of your civil rights. You haven't surrendered anything of your personhood. So how do we make that real for people and tangible for people?
Yeah, it's a question I struggle with well, every day. Thanks. There was an anonymous attendee who asked, she asked about getting, or they asked about getting our ombudsman. How do you get the ombudsman and community more involved with issues in long-term care? I mean, obviously ombudsmen are, I mean, that's the role of the ombudsman. So I guess if you wanted to speak at all in terms of, if I may interpret this person's question, is, you know, how do you engender interest? I mean, you know, we just talked, you just mentioned, you did mention, of course, in the program about, you know, bringing people in to the facility, getting them exposed to the issues. But it's, again, it's one, as I just said, it's one of those questions that I, you know, deal with in my own work, of course, every day, is how do you get people interested? I think, you know, we have a lot of ageism and ableism in, you know, in this area that is hard to overcome.
I also think, I agree with everything you just said, but I also think ombudsman programs are not, and I don't want to speak for all ombudsman programs, are not historically known for being the best promoters of their own activities.
Hmm.
They do what they do because they know they need to do it, and then they don't really brag about it. So sometimes people don't realize how deeply involved some ombudsman programs are in their communities. And I don't mean just us, I mean throughout the state, throughout the country. I know of some amazing initiatives by ombudsman programs, but they maybe aren't going to have the resources to have the huge social media presence or the whatever, where people are going to be hearing about it. So maybe that's one of those things too, is how do we get the word out about the work that some of these amazing ombudsman programs are doing?
Thank you. Thanks. Mikkel Rappaport, I hope I'm pronouncing their name correctly. Have you invited others to be on your team, such as CSAs? And I'm not sure what a CSA is. Placement agencies. I am an owner of a senior care consulting agency. Maybe that's what that is, senior care consulting agency. And we assist with senior living placement, including nursing homes, transitional care, and advocacy. We're constantly challenged with finding placement for LTC under the state Medicaid program, et cetera. So I think in terms of team build, you know, in terms of having someone in that capacity, as part of your team, or part of, you know, the group that you're convening.
We want to be pretty careful about conflict of interest in any of this. And so I think we're pretty careful about who gets invited, not in order to be exclusive, but in order to have open conversations when really, you know, when bad situations might be happening. So I think we want to be circumspect about that. The same as, well, Rachel, do you have anything to add? I don't want to take up.
Well, sometimes what we also do is we have almost ad hoc or subcommittees that meet related to a specific issue. So maybe not all members of the team need to know about the details of a specific case related to a particular crime, a particular thing, right? So there's a break off of the folks that need it. And at times, there is asking other agencies sort of some consultative kind of questions, like as a hospice provider, how is this or that working, without sharing or divulging information, right? Or as a placement agency, are these facilities telling you they can provide this or that service when we know they can't or they won't? So I do think there's room for that, and it may be something that we talk about in developing, but we also, like Dr. Mosqueda said, have to be extremely careful about the conflicts of interest, especially for some of our programs more so than others.
Yeah, it's, I mean, I find surprisingly nuanced issues in terms of Tony Chicotel, who I know you know from California Advocates for Nursing Home Reform, one of my favorite people, has asked, has there been any consideration of passing city ordinances setting standards of care or a licensing system? I think it's really interesting.
Do you want me to have it that one, or do you want to do
Sure.
it?
Mhm.
So yeah, we have actually talked about that. I mentioned something earlier about something that the city was suggesting. Hey, if the state isn't doing it, can we do it? And we're going to find out if we can pass an ordinance in order to do that. I will say there's, in my opinion, there's a bit of a game of where's Waldo sometimes when we're trying to figure out who's responsible for doing what. They've made it so confusing,
Mhm.
whoever they is, right? That sometimes you don't know who to go to, and the buck keeps getting passed when you know something bad is happening, which I find frustrating and more intentional than I had realized. And getting appropriate authorities involved when regulations are not being followed, I think is a struggle that would be a relatively easy fix to what some of the problems are. The extent to which this can be done at local jurisdictions, I think we're just beginning to ask those questions, and we'll see where it goes. But we're just on the cusp of doing that right now.
And they have used certain code enforcement ordinances basically to facilitate environmental improvements that had direct impact on residents' quality of life, which was pretty awesome. Because we don't have any new construction here. So our buildings are very, very old here in Los Angeles County. And so they were able to sort of mandate some requirements in some of our buildings that were really problematic.
It's really interesting. Yeah, it's another really interesting question. Anonymous attendee asked, what is your greatest challenge going forward? And I assume that there are a lot of them, but I guess if you could think of one that is, hitting you, I mean, what you're really thinking about in terms of your challenges for each of you, that would be really interesting to hear.
On a personal note, and I don't know if he's on this webinar, but I'll go ahead and say it out loud, is our assistant city manager does threaten retirement from time to time, and we have vetoed that, and we do not allow that. But on a more serious note, the sort of group dynamic changes whenever a new group member comes in or group member goes out. And so there is a fluidity to this team. And we've sort of had to build in the culture within some of the agencies. So the police department being one where that position, the person who attends Petal, that position rotates fairly frequently, every 18 months to 2 years or so. So you kind of get somebody who's fully up to speed and really understands kind of the work, and then we start all over. And I jokingly have what I call my welcome packet for new fire captains, because they tend to be stationed at the station that responds to facilities. So that transition and building that culture, I think we're making progress with it. But I'd like to know that this would continue if I was not in this seat, and if the city manager was not in this seat, and if Dr. Mosqueda was not in that seat. I'd like to know that we've built enough of an inroad that it would continue. And I think that comes with things like both the willingness and funding.
I'm going to just take two more questions, if I could trouble you for a few more minutes of your time. One is from an anonymous attendee. What did you do to get the various agencies to the point of dedicating people and resources to participate in Petal? What is their state?
Persistence. I typically make agencies an offer they cannot refuse, and I can demonstrate how we can actually assist their outcomes, right? I've been able to demonstrate initially with our work with the fire department, but getting unnecessary calls to service down because there's a misconception about what their role is. Similar with the police department. In one community, not Pasadena, in another community, we did, I personally went to a facility where residents called quite a bit, and we did an outreach with the residents. So it was myself and a community-based police officer, and we did a presentation called "When Do You Call Your Ombudsman and When Do You Call the Police?" And we were able to sort of break down those communications for them. And I think it's really showing the agencies ultimately, I'm an ombudsman, I'm a social worker. At the end of the day, I want what benefits the residents, right? But I'm gonna get other people to the table by letting them know how it's gonna benefit them and their agencies. And so I think it's really demonstrating that and the willingness to help. Like, I can now tell you that I know things about the EMS world that I never thought I would know starting out, or law enforcement or city management, and learning that world a little bit so that I can better understand what the code enforcement officers are going through when they're out there. And I think there's got to be a little bit of that too.
Great, thank you so much. Having a little trouble raising my website again, raising up my computer again, excuse me. So I'll just mention quickly to please, for everyone, thank you both very much for a terrific program. I so much appreciate it. Our next webinar will be November 19th at 1 p.m. Eastern. You could sign up at bit.ly/NOV-2024-webinar, or just go to our website. And otherwise, I'm going to say thank you very much. Thanks everyone for attending, but bravo to both of you and to everyone you work with for this just incredible and inspiring work. Really, really appreciate it, and on every level, personally and professionally. So thank you all very much. Thank you both very much.
Thank you so much for having us.
Thank you. Bye-bye now. Bye, everyone.